Thank you. So, as you can see from the title today, I have a lot of co-authors. Part of that is I basically stay in the lab in Ithaca, and the fisheries managers call me when they have problems and want me to investigate. And usually it's the technicians like Greg that actually bring me the fish. I don't get to go in the field very often, so I just want to thank all the guys that get me fish. Loredana is the technician in the lab, and Hélène is my colleague in the aquatic animal health program. So I'm going to tell you about 2 case studies this morning, and they both are co-infections. So why do I care to tell you about co-infections? Because when you have more than one pathogen, you can have either a synergy where they both are actually amplifying the problem. So you have, it's like getting robbed, all right? It's say there's 2 guys, they're robbing you. It's bad enough they're going to take your wallet, but when the other guy stabs you before he leaves, then that's like a co-infection. It just really, it makes it much worse when you have 2 bad things going on. So, in the first case, we're going to talk about a bacterial infection and a viral infection. The same in the second case, just different bacteria, different viruses. We're going to even add some parasites into the mix. So, I assume everybody here knows where Sodus is in Oneida, but I had to put it in there. So let's talk about the first case. So it was reported that there were dead and dying sunfish, so bluegills and pumpkin seeds, a few largemouth bass, and black crappie. So this is at the northern end of Sodus Bay, early May. So what was submitted was, just like always, fresh dead or morbid fish are the best. And so what was submitted was actually pumpkin seeds. So we do the same thing no matter what's submitted. We're going to do skin scrape, gill clips, look for parasites, fungus, some bacteria I'll show you. And then we did see a few parasites, which I have some pictures of. And then when we opened up the fish, more helmets, more metazoans. But what got me worried was the hemorrhagic lesions that I saw in the liver and the ovaries. So I've been working, those of you who've heard me before talk about viral hemorrhagic septicemia, we've been working on that for over 12 years. So seeing these signs immediately sort of raises hackles on the back of my neck like, this could be VHS. So fish number 4 had a huge enlarged spleen, and I've already forgotten to tell you that there were no real external lesions on these fish. All right, so they were just, they weren't what they were dying, but there were no obvious external lesions. So what we do, and I don't have it labeled in here, but I actually opened up the fish. First thing we do is culture the kidney to see if there's a bacterial infection. All right, but we also then take organs and save some of those organs. Anna Conklin talked about it yesterday. So we'll take pooled organs, and we'll actually, some of those organs will be homogenized and put on fish cells called EPCs. It's really a fathead minnow cell line. And then we'll look for CPE, another acronym, so that's cytopathic effect. Is there something in those organs, like a virus, that will make those cells look bad and then die? So we in fact did see CPE in those, and then we confirmed it was viral hemorrhagic septicemia, that virus, and particularly the 4B, which is what's in the Great Lakes, by real-time reverse transcriptase PCR. So the weird part about this, with those hemorrhagic lesions, I expect to see millions of copies, at least hundreds of thousands to millions of copies of virus in that 5 microliter sample that I test. So it's about 50 nanograms of RNA. I didn't see that. Number 4, which had the swollen spleen, had the highest level. The BAC-T came back really quickly. We sent it over to the Animal Health Diagnostics Center, and they diagnosed it as Pseudomonas mandellii. And I know most of the bacteria, never heard of that one. I'm like, what is going on? So that same week, we get sunfish from Canisius and someplace on the Seneca River. I actually have not pinpointed exactly where, but probably between the two lakes, I'm not sure. But we had the same bacterial infection in the same species without the virus. So I Google Pseudomonas mandellii, right? Sunfish. Immediately there's a hit. My colleague Jan Levy had diagnosed the same thing in 2015 from the same species of fish, same cold spring temperatures. There's a picture from the article with obviously no external lesions on these fish at all, and it caused a die-off. So now I got two pathogens, right? Pseudomonas and VHS. Which is causing the kill? You know, who are you going to put the pin for this? And so, just for the parasitologists in the room, this is what a metasacaria looks like in section, and this happens to be a spleen. When we did the scrapes and the clips, we saw a dactylogyrus. This monogene has these 4 eye spots there, so that you can tell it. There's another monogene called gyrodactylus, but you can easily tell them apart. We had some stalk ciliates also on the gills, but none of these in really high enough numbers to be part of the problem. When we sectioned the tissues and did a gram stain, start looking for these little red rods in every vessel that you see blood in. So in the ovary, these are the Pseudomonas. They are in every tissue. Every tissue that I looked at and stained with a gram stain, you can see this bacteremia was all over. Even in the liver, and finally, even in the vessels of the brain. So, in my mind, I had a low level of VHS, and I had bacteria everywhere. Cause of death is the Pseudomonas, right? So, of course, as I literally had just emailed the report and I'm not going to name the Region A manager, but they call and say, we're sending some more fish over. And I'm like, I just sent you the report. We've got a diagnosis, so I don't want to do any more fish, right? But I do them. So I culture them. It comes back Pseudomonas again. The VHS, I didn't want to do it. I was going to a wedding in Oregon, right? Somebody comes in and says, can you show me how to use that fancy extraction? We have this magnetic bead extraction machine. I'm like, yeah, because I have one day, right? I'm like, yeah, I have some things to extract, and so extract them, and then I'm like, might as well run the PCR, right? It takes like a half an hour to set it up, so I'm like, I'm pre-writing now the second report, right? Come to find out, when I go in to check the machine, instead of being like hundreds of copies, I got millions, tens of millions of copies in every fish that I sampled. So now it's like, what's my diagnosis now? It's like, I think I started with a bacterial infection, and that those fish just became more and more stressed. So by the second week, we had more of a big viral outbreak going on. So, like I said, it's never good to have two things going on at the same time, particularly when there's serious pathogens. So, the P's just show where we found Pseudomonas, and the V's, there was actually a big outbreak in gizzard shad in Irondequoit Bay late March, actually on my birthday in March. So that was a good present. So, I don't know how much time I have left, but
10 minutes.
10 minutes, we're doing good. All right, so for the Oneida, this has been going on for a couple of years. So the smallmouth they're not acting right. So the fishermen put it like, some of the fish are just kind of morbid, and then there's other ones that have these really gross not to make the pun, but really gross lesions. But those fish, when they were hooked, were like fighting like the normal fish, not lethargic. So I'm going to tell you about this case. We cultured, I'm going to show you pictures of 2 fish. So we got 2 fish to begin with, and then I asked for more. And Tom and Randy provided another 10 fish for me. So we culture E. tartar from them. All right. So E. tartar is a classic disease of catfish, and one of the lesions it makes is holes in the head. They literally will just eat their way. I assume it's outside in, but I'm not sure. You end up with a hole in the head. And then columnaris is flavobacteria. That's one of your most common bacterial pathogens. And that just gets on the gills and makes the gills look necrotic, and you can kill fish just with that. But I obviously tested them for VHS, right? Even though there was no big hemorrhaging in these, just this really bad external lesions. But they were negative for VHS. So the other thing I was worried about was largemouth bass fires. We had seen that in surveys not causing any kind of mortality way over, like 2005, 2006. So we ended up testing them for LMBV, again by a quantitative PCR method, and 7 out of the 12 were infected. So I'm going to show you pictures, gross pictures of the first 2 we saw submitted in, I think, late September. I'm forgetting the months. So here's the perforation I mentioned in the head. Like here's your nares here. That doesn't belong there. And then this erosive area, that, maybe it originally might have been a hook wound, who knows? But it definitely is not a good lesion to have. So when we opened that up and looked inside, first thing I didn't like, this sort of fibrinous covering on the spleen, that should be just bright red. There shouldn't be that sort of film. So that's already there's some kind of inflammatory response. Look at all the parasitic, these cysts here, and you actually have worms, coming out right onto the surface. All right. Also, signs on the inside. You had swollen atrium. You had pale ventricles. You had other clinical signs that indicated that something else was going on. So fish number 2, that was the one with the putrid lesion on the right-hand side of the fish. When we opened that one up, that one had I'm kind of blaming the parasites on this. This one had so many adhesions. So you can actually see these sort of fibers. All the organs were all like bundled together, one big mass, and they're stuck to the wall of the fish. When I took the scalpel and guessed where the spleen was supposed to be, you can see all the encysted parasites in the spleen. You can again see them externally here. You can see the pylorhizidae, but there's so much fibrosis that it's amazing that fish, think about it, that it could survive with that huge eye lesion and the internal organs looking like this. So I asked Tom for 5 more fish. He got me 10 more fish, and he actually took such great pictures. I didn't take pictures when they came in, so I'm going to show you 4 of these fish, and they all have lesions around the head area or the eye, or both. So this is what the gills look like. This is what a gill with columnaris, this flavobacteria, this is what it looks like. All the tips of the gills were just eroded a bit. And when you stain that, you see these gram-negative bacilli. So if this gets severe enough, just by itself, you can die from that. The fish can die from that. So this is the one lesion I could pin on the largemouth bass virus. And so it'll attack and basically break down the nuclei, so you get a fancy term for karyohexis. So these little darker dots here. And then just to show you a couple more parasites. So I could have showed you parasite after parasite. Every field, every cut had so many parasites in it. And then this is just, if I had a pathologist in the room, these are just what these fibrotic lesions look like. And then one more parasite, and then this was the kicker. So I don't diagnose by Google that often, right? But I did. I was just like, we had diagnosed it in smallmouth bass years ago. While we were doing the survey for largemouth, we tested a few smallmouth, and we had LMBV in those smallmouth years ago. And other people had investigated this. This paper basically came out last year out of the Pfizer lab at Michigan State. They actually got disease-free smallmouth, small smallmouth. They not only injected them with LMV, and the lesions they got were the exact same. If you go to the paper, the lesions are the exact same lesions on the head and the eye, and a few other external lesions. They basically replicated the disease that we were seeing in Oneida this year. And by chance, they co-infected them with Flavobacterium columnare and I think Airmona salmonicida, furunculosis, which in both cases made the fish even sicker. So, question here is, which is the problem? This one is hard because there's so many parasites. That load is so heavy that had to stress those fish out. The bacteria, I suspect, may have come in after the fact, but I think this is actually a largemouth bass infection. Water temperatures were like one of the 5 highest years ever in Oneida. That virus, that iridovirus, loves those warm temperatures. So I just want to again thank the guys at the field station and the DE staff that helps me with collections, and I have time for maybe 1 or 2 questions.